On April 24th, the Chamber hosted its third workshop on the status of the Federal Health Care Reform Law, otherwise known as the Patient Protection and Affordable Health Care Act. This workshop was particularly timely, as the Supreme Court had recently heard oral arguments on the act. The panel, moderated by Wardell Sanders, Esquire, chairman of the Chamber's Health Issues Committee, kicked off the panel with an overview of federal health care reform, including the timeline for implementation of the act and the Chamber's work on health insurance exchanges. Dr. Joel Cantor, director of the Center for State Health Policy and professor of public policy at Rutgers University, focused his presentation on the findings of the center's research on health insurance exchanges in New Jersey, and who is likely to gain coverage under the Act, depending on the Supreme Court decision. The next presenter was Douglas Grimm, Esquire, partner and chair for Health Care Practice Group for Stradley Ronan Stevens & Young. With everyone waiting to see what the Supreme Court decides regarding the constitutionality of the Affordable Care Act, Douglas outlined the major issues before the Supreme Court, including the question of the constitutionality of the individual mandate and Medicaid expansion. Aaron Lieber, Director of Marketing and Product Innovation, and Ryan Petrizzi, Director, Sales Operations and Small Business, both representing for AmeriHealth New Jersey, were the next speakers. Aaron provided an in-depth analysis of how health care reform and health insurance exchanges impact individuals under specific circumstances. Ryan's presentation provided an explanation of health insurance exchanges, how they work, and critical concepts and considerations in forming an exchange in New Jersey. Doug Lubenow, President, Lubenow Agency, and a member of Kistler Tiffany Benefits Senior Advisory Unit, discussed the role of insurance brokers today and in the future, especially within health insurance exchanges. He also addressed the role of navigators, which are required under the Affordable Care Act to educate consumers on qualified health plans. The final panelist was Louis D. Pavona, partner Withum Smith & Brown. Lou addressed the major tax provisions of the Affordable Health Care Act, including the new W-2 reporting requirements for employers, penalties that employers face if they do not offer health insurance, and small business health care tax credits. After the panelists completed their presentations, attendees had the opportunity to participate in a Q&A session. Following a lively question and answer session, members had the opportunity to meet one-on-one with the panelists to continue the discussion and get answers to their specific questions. The Chamber thanks our sponsors, AmeriHealth New Jersey, Stradley Ronan Stevens & Young, and Kistler Tiffany Benefits. We would also like to thank our panelists and members for their participation in this important workshop. Be sure to visit our website at www.chambersnj.com, like us on Facebook, and follow us on Twitter.